Hello, my name is Carol Fordham-Clark and I am the simulation lead at the Florence Nightingale School of Nursing and Midwifery at King's College London. Last year we developed a simulated community placement for first year adult nursing students on the undergraduate BSc programme. Once they had completed this simulated placement, they then undertook an actual 4-week placement in the community. Simulated learning, as proposed by the NMC, enables student nurses to learn and rehearse core nursing skills and values in a supportive learning environment. The intention of the simulated community placement was to give students an insight into those core skills and values pertinent to community care. Activities throughout the week focused on the role of the district nurse and the role of the practice nurse and involved service users. Such activities focused on both clinical and communication skills. Activities included reviewing local health and social services, patient assessment, wound care in the home environment, supporting patients with long-term conditions such as COPD, collaborative care planning, and the role of the multidisciplinary team in patient care.
We used questionnaires to gather data prior to the simulated placement. We wanted to find out if students had any previous community experiences and also if they had any particular anxieties or expectations around future community placements. Previous experiences were varied. Some students had gained meaningful experience while working as community-based social carers or caring for a family member, and some students' experiences were limited to their own consultations within a GP setting. We found that students were looking forward to developing stronger relationships with patients. However, there was some awareness of how these relationships would develop during relatively short consultations. Students were also looking forward to gaining new insight into long-term conditions management and holistic nursing care outside of the hospital setting. We also used questionnaires to capture evaluation data at the end of the simulation week. The week was evaluated really positively. Overwhelmingly, students reported feeling more confident and prepared for their community nursing placement, having gained a better understanding of the role of the community nurse.
Students who participated in this simulated placement last year have now had the experience of undertaking a community placement supported by mentors in practice. The anecdotal evidence suggests that they found the simulated placement both beneficial and relevant to their experience. We are now looking to further evaluate the simulated placement with the students so that we can adapt and modify the content and create further learning opportunities for them. We are fortunate to have a skills centre with a homeroom. The homeroom has been set up to look like someone's front room, and we use a mannequin and various props to make it as realistic as possible for the students. The students also have access to e-learning materials. Students have reflected during debrief sessions that it's allowed them to think about how they need to adapt their communication skills and also their clinical skills when working in the home environment. They have also looked at community nursing in a more positive light, and indeed many of them are now thinking about a career working within the community setting.
The HEA support the development of excellence in healthcare, and via their collaboration with ASPI, the Association for Simulated Practice in Healthcare, are keen to develop the role of simulation. Their work has therefore supported our project to develop a simulated placement.